What will Alzheimer's treatment look like in the future, but experienced today? This is Dr. George Moricz with the Alzheimer's Treatment Centers of America. A question that's on so many people's minds, but are afraid to ask. So imagine this. Imagine you've already registered in a program and we've already worked up the individualized assessment, testing, reevaluation, and we're doing simultaneous treatment, intervention. And I could talk a lot about that, but each of you are individualized. Having helped thousands of people over my career as a doctor of 30 years, I've learned that for me to give you the exact recommendation, I would need all the information. And a lot of you are nodding and saying, well, that's fair. So what is something that would be different that by itself, which wouldn't commit you into anything, would show you how different this approach would be? So let me give you a little sneak peek. Imagine this, you come in and we do a frequency analysis. See, everything is frequency, whether it's the wireless that you use, your garage door opener, it's all frequency. My voice, if you hear my voice, that's frequency medicine. Inside your body, there's already disruptions from electromagnetic fields. You have these endocrine disruptors in the environment. Basically, your body's already disrupted. So you would get a frequency analysis, and within a half an hour, using a Tesla coil, I could actually show you why you are in the situation that you are. But there's more. Imagine doing a brain analysis, an actual quantitative EEG. This will be one of the kind you will find literally nowhere else. And in a half an hour, while looking at a screen, no silly tests, no circling numbers and doing these mini mental status exams, we can actually map out for you the type of cognitive decline, which is as good as any PET scan, all done within a half an hour. So you would leave with all this information of what has caused you to where you are now, what actually is your level of decline, and all done in as short a time as watching a weekly sitcom. Once you see this, the power of AI, you'll start to ask yourself, well, what else would be in store for me? And why hasn't AI been used? Look, it's been used in commerce. It's been used for space shuttles. But why is it not being applied in medicine? And you might really be thinking, well, if they really wanted to solve Alzheimer's dementia, then wouldn't big companies have already done this? Well, you can decide for yourself on that. But in the meantime, I look forward to catching up with you. Remember, let's stop the decline using AI. Dr. George Moricz with the Alzheimer's Treatment Centers of America.